Hey everybody, how's it going? It is now Sunday, May 24th. Last time I did an updated video for you guys was at the beginning of April. I think maybe it's April 1st or April 2nd. It was around there. So I wanted to update you guys on some things that are happening here. Before anyone says anything, a lot of people comment to me, oh, you lost a lot of weight, you look great, blah, blah, blah. Please stop, first of all. I lost a lot of weight, and I'm going to give you a theory here. I lost a lot of weight because I got really sick, and you know, wasn't really losing control of my bowels, but they weren't coming out right. I'll just leave it to you that. So things were pretty bad for me in February and March. At the time, I thought maybe I had COVID or coronavirus, but or after it was all said and done. But they started to subside maybe about mid-March or so. So I was like, all right. I'm like, well, you know what? I'm like, you know, maybe I'm starting to go back to normal. I mean, I had everything. I was losing appetite and couldn't, you know, I was feeling really weak. I have my theory now that, you know, since nobody found anything, since they couldn't find anything, I've been to the doctor and they couldn't find anything, nothing was wrong. My new theory is that because of what's going on with my neck, with the spinal cord being compressed, I think that the chiropractic work that I was going to was actually causing more problems for me with the spinal cord compression and making it worse. I've heard that if your spinal cord gets compressed, or even if it gets, or if it's damaged, you know, you can lose control of your bowels and your bladder and stuff like that. And like I said, I haven't lost control, but it was definitely different. Things were definitely falling different. So there is a lot that happened there. So imagine your life, like my life right now, where you can't go out to go see friends as much as you want to, or go do things. You know, let's say everything is open today, right? And you're able to go out and do things, you know, normal here. You can't go out and do things because your neck is all messed up. Like driving 15-20 minutes is almost excruciating for me. Let's say that you know, you can't see family. Like, that's the other thing. I know I'm not going to be able to see my family as much as I want to now because of how bad this neck issue is. You know, so going out and I should say having fun is you know, not happening for me right now because of this, and my life is not the same as it was. You know, I was playing hockey, you know, over a year ago, and I can't even see myself doing that right now because of how bad my neck is. It's just how it is, unfortunately. It's progressed, you know, into worse over the past year. I do want to say that I think, for the most part, why it happened, or why it's progressed even worse, was because of the fact that I was in an accident in 2018. And when that happened, I think it actually exuberated a lot and made things much worse than I was. There are days I'm you know, thankfully, I'm home and I just can't even sit down for long, and that's horrible. So I'm going to present to you my symptoms first of all, what happens here and what I'm doing with these symptoms, and then I'm going to go over with you guys my neurosurgery follow-up, because there's been some stuff that I've had questions on. I don't know if I presented that to you in my last video, but I did have a follow-up with him, I believe during that day, or the day before, or day after, and then also a follow-up with him just this past week. So my symptoms, my neck feels like it's too tight. I mean, that's for certain. Though I can move my neck to the right, to the left, or like this. Now it hurts all over here. When I do that, it hurts all over here. And then again like this. Now I'm better in this chair than anywhere else. Like sitting down on my kitchen table, kind of difficult for too long. Sitting down in the car, forget it. If I'm doing that, I'm just like, I feel like my neck is just like so weak, and like things are gonna snap and break on me. Like, that's how it feels like when I'm in my car. Whether I'm driving or whether I'm a passenger, that's how it feels like. So it's very nerve-wracking because it really gives you a lot of anxiety and a lot of panic when this happens, because something's going on with your neck, and from your neck down, everything shoots down your body, right? So that does happen, and it happens when I'm sitting down too. I've had 3 cases where my arms have actually gone numb while driving. Believe it doesn't happen any other time except while I'm driving. So clearly, you know, it's like this, you know, I'm just driving or whatever, I'm driving, however I'm driving, whatever. And, you know, I've had it happen where I'm at a red light, the arms went, you know, arms went tingly, numb, and that's it. And I actually felt like I was going to pass out. So I had a lot of extreme pain over here. Everything was so tight and compressed, my neck. And I was like, holy cow, I'm like, what just happened there? Same thing driving in a high, you know, and then I started moving and I was okay. But then same thing happened driving on the highway. Went to go get my car serviced. It was even like it's a quarter-mile drive and same exact thing. Pulled over, got up, felt okay when I stood up. Maybe a little, you know, whatever. But same thing happened. And another time just driving around town happened again. Seems to all be related to everything happened up here. I have talked to my neurosurgeon about that, and he said that this is actually a common complaint with what I have, that it does happen. You know, he's heard a lot about this. So that happens. Does feel like the bones in my neck were not in place. It does feel like I said, something's going to snap or break. I definitely feel like things are not where they should be. When seated at rest, you know, I'm constantly trying to pull my head up like this, like traction. So it's pretty bad. And I'm even looking at my neck and it doesn't seem like it's straight. Like, so I feel like something's off very much. Most of the pain, again, from over here. What I tried to do, I'm going to show you a couple of things that I've tried to do. My own little physical therapy at home. I haven't been using all the other stuff that I've been using, like neck braces or anything like that. I guess it's maybe a little bit of improvement there. But, you know, sometimes I go like this and have to pull up on that, or sometimes even below here. I got to be careful with here because I had a tooth pulled, and I need to, and the tooth pull, you know, I was okay with that, but yeah, so that's there. So I'm trying to do that, sometimes I'll put on the collar that I have here. If I feel like my neck is very unstable for the day, I'll put on the collar. Sometimes I'll leave it on for an hour or two. So just to keep my neck feel stable. It doesn't feel stable. And again, a lot's coming from up here. I just feel like a lot's coming from up here. But yet they're focused on C5, C6, C6, C7. So I don't know if that's further down here, what the story is. But sometimes I use this. This came from the chiropractor, made me buy, I guess it's like a dinner roll. You lie down on it for a few minutes, you know, a couple minutes, maybe 2 minutes, and they really, you know, say, hey, you know, just lie down with your neck on there, and that's it. And one thing that's definitely helped a little bit with the strengthening for me has been the band from physical therapy that I had was, you know, like this, and then like this, and I said, see, I just felt a crack, right? As soon as I did that, I felt a crack, like just felt a crack, like snap crack. That, and then like that, and then, you know, down here, and then row. So put this around something and then row it back and then put it down and then pull it down to something there too. So yeah, I do that as well. So it does sound like there's lots of cracking and something's ready to snap and break in my neck there. Upper cervical more sounds like, I don't know if it's really upper cervical, but definitely sounds like lots of crunching going on in there too, which isn't good. My legs and feet sometimes may tingle while I'm driving. It leads to weakness in the body. You know, every once in a while. It hasn't happened that often though, thankfully. I mean, but that's whatever it is. Definitely have muscle wasting in arms and legs. Maybe my legs aren't as weak as they were. I've been doing some good walking, but you know, definitely had some muscle wasting here. So maybe some of it's come back though, so I'm happy about that. But I haven't been able. Like I have a farmer's stand. Definitely have a farmer's stand. The problem that I have is that, you know, I'm not gaining the weight back. I guess it's not a bad thing. I'm at the weight I should be. But yeah. You know how it is if, you know, you lose weight and you're not feeling good while you're losing weight. You know, it's a different story when you lose weight and you're feeling good. And you can say, yeah, I lost weight. I've been doing great. Blah, 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 blah. But when you're not feeling good, you know, you don't even want to hear it. Like, yeah, you lost a lot of weight. You look great. Thanks. I feel like crap. I mean, as simple as that. Okay, lying down. Sometimes I'll lie down on my back. I try to get up. You know, I'll feel woozy, lightheaded. That did start about January, and it's probably started right around the time I went to the chiropractor. Really, I noticed that too. But I feel like my head's just gonna roll off my neck, and like I have to support it sometimes. I'll be like, oh my god, I'm like I gotta support my head, my neck, because I just feel like, you know, I'm afraid that like, you know, I'm gonna black out or something. Like, and that shouldn't, but it's coming off from my neck. I can tell it's coming from my neck. So that happened. Tinnitus, still have it in my ears. I brought it up to neurosurgeon. Neurosurgeon did say I can't really do anything about that. Sorry. But I really think the tinnitus is coming from something in the neck at this point, because the tooth that I had pulled was the tooth that I had a root canal done on, and that was the one that started my tinnitus. Now that I had that tooth pulled, unless it's the other tooth that I had work done, now that I had the tooth pulled, gone. And by the way, that tooth was infected, and not only was it infected, it was also fractured. So it had to go. So yeah, sometimes I'll feel like, you know, when this has all been happening, I feel too weak to support my body going up an escalator. Definitely have a balance problem, makes me feel like I'm gonna fall backwards. So I'm gonna be holding onto the escalator for dear life, and like I couldn't even tell you, like, it's just so bad like that. Sitting in movie theater stadiums not only causes pain in the neck, but body weakness, but also messes with visual perception. Visual perception has gotten pretty bad for me. Visual disturbances, I guess. So sometimes it's more prevalent when I'm sitting down for too long, and a lot of people see me, you know, ooh, see, I just felt all up here, all the cracking. As soon as I did that, I felt all the cracking. A lot of people see me when I sit down for too long, you know, they see me try to pull my neck up because that's all I can do because there's so much pain going on over there. But they also see me try to pull my neck up like that. And then driving wise, it happens if I drive. Maybe not during the day as much, but like I'm sitting at a traffic light, this hence why that whole thing happened. Or at night is when it's the worst. It never used to be bad at night, okay? Until, I want to say, when did that start? I want to say probably about August of last year, maybe September of last year, when it started to get really bad again. So yeah, sitting down, moving my head up and down, I felt some snapping and popping, like there's some sort of tendonitis. Again, I can even tell my neck's like not even straight. It's like it just feels like, I just felt like it's this and that. So something's definitely going on with this here. Pain's mostly over here. Pain's mostly over there. Okay, so I asked the neurosurgeon to go over my MRI again. He went over my MRI. He basically said every level of your neck is herniated, but then he drew a line, and that line went from, I believe, let me see, I believe the line went from C, where did he say? Let me just see what he said here. So I'm looking at my image, and by the way, that image that you see at the beginning, at the thumbnail, is actually the image of my cervical spine. Yeah, so C2, C3, so everything below C4 is pretty much has a herniation or bulge of some sort. So he said that while C3 and C4 were looking pretty bad, it only had mild stenosis. C4-5 wasn't that bad, but again, mild stenosis with a little bulge. C5-6 was pretty bad with the herniation and a moderate stenosis, and C6-7 again severe stenosis and pretty much a bad herniation at that point too. So he really didn't go over C2 or C3. Looking at it, I don't know if there's necessarily anything wrong here. Trying to get some different opinions. But a lot of people are saying, you know, you might need to go from C3 down and for this. So I asked him how much progression it was from the 2015 MRI. He really couldn't tell me, or 2014 MRI. He couldn't tell me he didn't have the 2014 MRI. He said it wouldn't make a difference anyway. Basically, they have what they need to do the surgery at this point. Surgery is now no longer elective. It is actually a needed surgery. It's an urgent surgery. It's not an emergency yet. However, I could be, you know, if I don't get it done within the next few months, it could be very much considered a very serious surgery down the road. You know, I could stay where I'm at for 5 to 6 years from now and you know, still stay where I'm at, or I can improve things by getting the surgery done. I asked him if there's any additional imaging or testing in case something was missed. He said not really, they have everything they need. Brought up the issues again with where the pain was here, and you know, kind of just, you know, he went over the MRI again there. Any non-surgical treatment, basically he said besides maybe 2 months physical therapy, 2 to 3 months physical therapy to maybe strengthen my neck and do some posture correction. Not necessarily, no. but that's not going to fix the problem, he said. So surgery is pretty much your only thing. I asked him if it's a family member, an urgent family member. If this was, if this was considered urgent, would he consider bringing a family member into the surgery? He said absolutely. So yeah, so we went over to MRI. So he went from there. Didn't have any. He said my symptoms 100% are being caused by this problem. While he said he can't promise symptoms will go away, because I think every surgeon is going to say that. He said he doesn't have a crystal ball. He doesn't know. He said it'll definitely improve things. He said, I think the last time I talked to him, he said that it was basically 80 to 85% chance of improvement, which is good. I don't need to I asked him if I could donate my own blood for this. He said no. I asked him for the qualifications of that physician's assistant because they were a little unclear to me. But he said 2 years of schooling. They were working for him for a few years. He said that I would not need to get fitted for a neck brace at all. The risks or complications of the surgery, I asked them, are for any complications of any surgery where you can have a heart attack or die from a surgery, or you can get a major infection. They try to avoid all that clearly. The other thing that they said, could potentially happen when you're dealing with the spinal cord is there's that less than 8% chance for paralysis. One good news about this surgeon, I'll tell you, I guess, a little bit of a story, is that there was a guy that he worked on, went into emergency surgery, and the guy had a 1% chance of ever walking again. And this surgeon performed an emergency surgery and got this guy walking in 3 days, like walking perfectly fine. And the guy was perfectly fine 3 weeks after that. So I guess there's some level of confidence there, which I'm happy about. I asked him why he's only fusing to 2 levels instead of 4, because originally the first thing that he mentioned was advanced artificial disc replacement. The first appointment, and then the second appointment I went to, he said fuse from level 5, 6, 6, 7 is a 2-level fusion. So I asked him why he's only doing that, and he says, instead of the 4, and he said that 4-level fusion is a very serious operation and a serious undertaking, and it's not something that he would normally do for this right now. Actually, he didn't say it's not something he just left it at that. He said that he normally wouldn't do the artificial disc replacement though at those levels, hence why we're not doing it. So I'll be honest with you, I did ask another surgeon about this, another neurosurgeon. Unfortunately, I couldn't get to him to go see him because A, it was too far and I couldn't really drive there. B, it was because of the fact the guy's out of network too. The guy suggested the same thing, 2-level fusion at that level. And then he also said that he would replace C3, C4 as well with artificial discs. So the 2-level fusion, anterior, and then the posterior, which is a little bit more rough because you got to cut muscles and stuff like that. Potentially cut muscles, and that kind of gets a little crappy. That yes, there's that, he could say you could remove the 3, 4 and put artificial disc in there. I don't know how that's going to go. So he did go over how they're going to be removing the disc, cleaning off the arthritis, putting the bone back with the cage and a plate. So that's kind of what we're talking about. I asked him if there's going to be more degeneration at other levels since the levels above already started. And he says that could possibly be so more surgery could be necessary down the road. Hence why I would rather get everything done at once, to be honest with you. But I know it's not that easy, and there are people that get this done. I asked him if he only be addressing what's being done at those levels. He said that's only what they focus on. It's only what they say they're going to do is what they're going to do. They're not going to be looking at anything else. I asked him if something got worse, would they take care of it? Like, for example, if there was a disc that collapsed or a disc that was deteriorated or something, or broken or whatever, or cracked, he said that they would take care of it. Pain in the hospital, I asked him how that gets managed. He does through medication. Unfortunately, because of this whole pandemic thing, no family member can spend the night with me in the hospital for this, so I'm on my own for that. I asked him if I can ascend a flight of stairs after surgery. He said don't do it like 30 times a day, but you could definitely do it for 4 to 5 times a day. Try to avoid it. He said don't try to do any major household chores for 2 to 4 weeks. He basically starts lifting the 5-pound restriction between weeks 4 and 6 up to 20 pounds. And then at week 8, a little bit more. And then the 3rd month, get into more, blah, 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 so on and so So I asked him how long I'd be seeing him. He said, 2 week. I don't know exactly what he said. He said he's seeing me at 2 week mark. I think he said 8 week mark, but I'm not sure if he meant 8 week or 6 week. 3 month mark and sometimes a 6 month mark. So it doesn't sound like a lot. A lot of times you see me. He did say that PT could probably start after 6 weeks, depending on how I'm doing. But it could be 6 weeks. It could be 3 months. It all depends on how my body heals, right? If there are any emergencies, I'd have to go to ER. That would be considered if I couldn't breathe or if I went paralyzed. Any other concerns, I had to call the office and they put me through with someone. Basically, it's a procedure. He did say I'd be out of work probably for 2 weeks, even if I'm working from home. But some folks do return earlier, some do return later. It really depends. Driving wise, he says that they sometimes try to go between 2 to 4 weeks to let people drive, but it depends on how well you can turn your head. So if I'm able to turn my head like I can now, it should be a little better. Strenuous activities like sports could possibly be returned to after 3 months. So he basically said, around the 3 month mark, if I wanted to play hockey, maybe I can, but I may not be fully healed at that point. So it really depends. If I'm fully healed at the 3 month mark, great. I did ask him for a recommendation for somebody for a second opinion. He did give me one, a name of a person, but the person, when I looked them up, that person didn't really seem like they had mixed reviews, mixed reviews from some people, but they didn't really seem too caring. But it's okay. At least he supported a second opinion. I've yet to really schedule the surgery. Let me just see what else I've missed here. I don't know what I went over with you in here. Vocal cords could get damaged, I guess. That's one thing. They said try to avoid that. No medications would be needed after the surgery, but you know how that goes. Surgery would take him about 1.5 hours to perform. Asked him about the other staff, the PA. Still didn't get a clear answer on there. Only 1 night in hospital. Recovery time would be about 2 months, where I'd be wearing a heart collar and using a bone stimulator every day. He did say I could return to daily driving. Just that's right, yeah. And then fully recover, heal time would be 6 to 12 months, but some people recover in 3. Really depends. Again, that's how it goes. Even though my symptoms are 100% coming from this, they are considered progressive. So this is a progressive thing that's happening, and it could be considered permanent. But it doesn't mean the symptoms are going to be permanent. It just means that so this is what's going to be stopping this. He does perform a little over 100 of these surgeries a year, and the success rate is considered 100% since nobody has any complications or failures. Well, that's a good thing, I guess. I asked him about the neck having a natural curve. He basically said that yes, it could restore natural curve at those levels. He did warn me I might feel like someone beat me up for 2 months after the surgery, but I'll see improvements very quickly. So I do have some concerns. Obviously, I've never had a surgery like this before in my life. Only surgery I've had was removing wisdom teeth and removing a mole on my back, and just removing this tooth as well. 2 of those surgeries I was awake for. The wisdom tooth one I was out for. The fact that I have a lot of concerns happening, like for example, I take medication on a daily basis. That medication does have that risk to give me bone density loss. If I take that medication daily, first of all, if I can't swallow for some reason, how am I going to take the medication? Can I crush it up? I don't know. Also, if it causes bone density loss, will it impact the bone from healing and the fusion and potentially cause the fusion to fail? I don't know that either. That's a problem as well. So that's problem number 1. The other problem is, I just had dental work done and I plan on getting an implant. How is that going to affect me if I have a neck surgery now? Do I have to wait for the implant? How long can I wait for the implant? What do I do at that point? They actually just put a bone graft in there to try to see how long, see if the bone can heal and all that good stuff. And they'll be putting an implant in there. So I don't know. I don't know how that's going to work. I had to talk to dentists about this because that's the thing. I did ask this guy about when I can get the surgery. He said if you schedule it next week, you're not looking to at least end of June, early July to get the surgery. So I do have a little bit of time on this. I'm looking at certain things like, do I need a recliner? A lot of people say you need a recliner. He said you don't need a special bed or chair or anything like that, but a lot of people say get a recliner. It helps out tremendously. So I'll probably be looking at that. It helps you get up a little bit more. So yeah, I don't know. I don't know what else to think about with this. Pretty scary for me. I've never really had surgery like this before. Was never expecting to be in this place in my life with this kind of surgery, even talking about it, but the fact that it's even necessary now, not even an option, it's just a necessary surgery. I do got to really start considering this, and who knows if there's going to be more. That's kind of what I'm kind of looking at, and if there's more, what do I do? And that's the other thing. What if I get the surgery and it does nothing to me, and I still feel the same way? Then I'm going to feel like I wasted my time getting this surgery, and I didn't fix the problem. And that's the other thing that scares me too. I do want to try to return to a normal life, about driving, getting to see family, even going to see a sporting game. Like I can't see concert sports. There's nothing like that because it's almost impossible. Going to movie theaters and stuff like that, it's almost impossible for me. It feels like my whole body feels like it's weak and crunch and everything. So I'm perplexed. I'm a little scared, and I guess I have to look at the positive side about this. Is I'm going to look at this and say, maybe I should listen to my family, say instead of you being scared, get excited that you're having the surgery, because the surgery could potentially fix you. And look at it from that end. If it can fix you, great. Of course, I'm thinking about all the potential risks about the paralysis and this and that, and the fact that you can have a heart attack and die, or you can get an infection and all this crazy crap. And, I shouldn't be thinking like that. And they're saying, just think about, getting this corrected and see what happens, and then that's it. So I have decisions to make this week. And it will be this week when I make these decisions. I don't know how quick they're going to come. I will keep you guys posted. I'm sure those of you following my social media know enough about it. Those of you on YouTube, maybe another video before I go into surgery, or whatever. Yeah, I'll keep you guys up to date and up to speed as to what it is. So, thank you everybody for listening. I hope you guys are doing well. And if you have any comments about this, leave it in the comments section, or reach out to me personally if you have your own experiences about this. Let me know how it went. Some people I know had surgery. They said they did awesome after the surgery, and they've noticed so many improvements afterwards. It was just the best decision of their lives. So I'm hoping that's what I do. Make the best decision of my life. So yeah, that's what I'm hoping. So yeah, leave a comment or reach out to me anywhere, and I'll see you guys soon. Take care, everyone.